Top 5 reasons for foamy or bubbly urine. 1 is kidney disease. Have you ever noticed your urine looking foamy or bubbly? While it might seem alarming, it's important to understand what it could mean for your health. Occasional foaminess might not be a big deal, but if you notice it frequently, it could signal an underlying health issue. One major reason is kidney disease, which can cause excess proteins in your urine. This condition, known as proteinuria, is a key factor behind foamy urine. Understanding the causes is crucial for early detection and treatment. Early detection can help manage and potentially reverse serious health issues. In this video, we'll explore the top 5 reasons for foamy urine, starting with a closer look at kidney disease. We'll also discuss other factors like a high-protein diet, dehydration, medications, and urinary tract infections. Each of these can contribute to the presence of foamy urine. By knowing these causes, you can take proactive steps to protect your health. Stay informed and take action to manage and mitigate potential risks. Let's dive into these causes and learn more about foamy urine. Understanding these reasons can help you make informed decisions about your health. Reason number 1. Kidney disease, specifically proteinuria. Proteinuria is a condition characterized by an excess amount of protein in the urine. It is often indicative of underlying kidney disease. In healthy individuals, kidneys function as efficient filtration systems. They allow waste products to pass into the urine while retaining necessary proteins within the bloodstream. However, when the kidneys are compromised due to damage or disease, their filtering capacity diminishes. This allows proteins such as albumin to leak into the urine. The abnormal presence of protein often results in foamy or bubbly urine. Research substantiates the connection between proteinuria and chronic kidney disease. A study published in the American Journal of Kidney Diseases highlights that proteinuria is not only a symptom but also a predictor of CKD progression. The presence of protein in the urine exacerbates kidney damage, creating a vicious cycle that further impairs renal function. Therefore, identifying proteinuria early is essential for diagnosing CKD and implementing timely interventions. Symptoms of proteinuria can be subtle and often go unnoticed in the initial stages. Aside from foamy urine, individuals may experience swelling, edema, in the hands, feet, or face. Fatigue and changes in urine output are also common symptoms. Diagnostic tests play a crucial role in detecting proteinuria. Simple urine tests such as a dipstick test or a urine protein to creatinine ratio can reveal elevated protein levels. Further diagnostic evaluations like blood tests and imaging studies help determine the underlying cause of proteinuria. They also assess the overall kidney function. The importance of early detection and management of proteinuria cannot be overstated. Timely identification allows healthcare providers to implement strategies aimed at slowing the progression of kidney disease. These strategies may include lifestyle modifications, dietary adjustments, and pharmacological interventions. Controlling blood pressure and reducing protein leakage are key aspects of management. By understanding proteinuria and its link to kidney health, individuals can take proactive steps to maintain their renal function. These steps are crucial for overall well-being. Reason number 2. Dehydration. Dehydration is a significant factor that can lead to foamy or bubbly urine. When the body is deprived of adequate water intake, it seeks to conserve as much water as possible. Consequently, the urine becomes more concentrated, containing higher levels of waste materials such as urea, creatinine, and various organic substances. This heightened concentration can result in the formation of bubbles or foam when the urine is expelled. The underlying mechanics of dehydration involve a reduction in the body's overall fluid volume. This can occur due to factors such as excessive sweating, insufficient water consumption, or illnesses that cause vomiting and diarrhea. As the concentration of waste materials increases, so does the likelihood that these substances will create visible bubbles or foam on the surface of the urine. Ensuring proper hydration is fundamental in preventing concentrated urine and the associated foaminess. The general recommendation is to drink approximately 8 cups, about 2 liters, of water daily. However, individual needs may vary based on factors such as age, weight, climate, and physical activity levels. Additionally, including water-rich foods in your diet, such as fruits and vegetables, can help maintain overall hydration status. Signs of dehydration to be aware of include dark yellow urine, infrequent urination, dizziness, dry mouth, and fatigue. Catching these signs early can prevent the progression to more severe dehydration and mitigate the risk of foamy urine. Studies have shown that maintaining proper hydration not only helps in keeping the urinary system functioning smoothly but also supports overall kidney health. Proper hydration reduces the chances of developing conditions such as kidney stones and urinary tract infections. By staying hydrated, you can support your body's overall well-being and prevent foamy urine. Reason number 3. Urinary tract infection or UTI. Urinary tract infections, UTIs, are a prevalent cause of foamy or bubbly urine. They often result from bacterial infiltration and subsequent inflammation in the urinary tract. When bacteria such as Escherichia coli enter the urinary system, they provoke an inflammatory response. This response can alter the urine's properties. One potential outcome of this process is the presence of tiny gas bubbles. These bubbles lead to a foamy appearance in the urine. Besides foamy urine, common symptoms of a UTI include a persistent urge to urinate and a burning sensation during urination. Cloudy or strong-smelling urine and lower abdominal pain are also common. In some cases, patients may experience fever and chills, especially if the infection climbs to the kidneys, causing pyelonephritis. The consistent pressure and irritation within the urinary tract contribute to discomfort and visible changes in the urine's physical characteristics. Treatment for UTIs typically involves a course of antibiotics, prescribed based on the bacterial strain identified through a urine culture. Alongside antibiotic therapy, increasing fluid intake is encouraged to help flush out the bacteria. For recurrent or severe cases, further medical investigations may be necessary to identify underlying causes. These investigations can include imaging tests or specialist consultations. A wealth of medical research underscores the significance of addressing UTIs promptly to prevent complications and preserve kidney health. Studies highlight the necessity of accurate diagnosis and timely treatment as key elements in reducing the burden of infections. Proper hygiene practices and adequate hydration serve as preventive measures to lower the risk of UTIs. Given the potential implications of an untreated UTI, seeking medical advice at the first sign of symptoms is crucial. Reason number 4. Vigorous exercise. Vigorous physical activity can induce temporary changes in the appearance of urine, including increased foaminess. During periods of intense exercise, the body undergoes significant metabolic stress, resulting in the elevated breakdown of proteins. This metabolic response can lead to a temporary condition known as exercise-induced proteinuria. When muscles are heavily exerted, proteins from muscle cells, such as myoglobin, can be released into the bloodstream. The kidneys filter these proteins, and sometimes, a portion may pass through the glomeruli into the urine. This increased presence of proteins in the urine can lead to a foamy appearance, resembling conditions associated with kidney dysfunction. Studies have shown that exercise-induced proteinuria is generally transient, often resolving within 24 to 48 hours post-exercise. It is important to distinguish this temporary condition from more serious, chronic kidney issues. Understanding the body's response to strenuous physical activity helps recognize that such changes are typically not indicative of lasting kidney damage. Research in the Journal of Nephrology highlights that exercise-induced proteinuria is common among athletes and individuals engaged in high-intensity training. This condition usually does not signify underlying kidney pathology. The kidney's filtration mechanism, under the strain of vigorous activity, temporarily allows larger protein molecules to pass through. This condition is quickly corrected once the body returns to its normal metabolic state. A balanced approach to physical exercise, with adequate recovery times and hydration, can minimize urinary changes. Monitoring urine appearance post-exercise is helpful but should be contextualized within an individual's overall health and activity levels. Reason number 5. Diabetes and high blood pressure. Chronic conditions like diabetes and high blood pressure significantly contribute to kidney dysfunction. often leading to proteinuria, which manifests as foamy or bubbly urine. These conditions affect the delicate filtering mechanisms of the kidneys over time, causing structural and functional damage. In diabetes, persistently high blood glucose levels lead to an increase in the glycation of proteins within the body, including those in the kidneys. This glycation results in the thickening and scarring of the glomeruli, the essential kidney filtering units. Over time, this damage impairs the kidney's ability to filter waste effectively, allowing protein molecules, which are usually retained in the bloodstream, to pass through into the urine, thus causing foaminess. Similarly, high blood pressure exerts excess force on the blood vessels, including those in the kidneys. The kidney's delicate filtering apparatus cannot withstand this constant pressure, leading to the thickening and hardening of arterioles. This process narrows the vessels and reduces blood flow within the kidneys, compromising the kidney's filtration capacity. Consequently, proteins leak into the urine, contributing to foaminess. Clinical studies have consistently drawn a correlation between prolonged hypertension and proteinuria. A study published in the Journal of Hypertension reported a strong association between uncontrolled blood pressure and increased protein excretion in the urine. The American Diabetes Association highlights the progression of diabetic nephropathy in patients with poorly managed blood sugar levels. This further solidifies the connection between diabetes and kidney damage. Managing these chronic conditions is pivotal for maintaining kidney health. Regular monitoring of blood glucose levels and blood pressure is essential for prevention. Consistent medication adherence and lifestyle modifications, such as a balanced diet and regular physical activity, help mitigate the impact of diabetes and high blood pressure on renal function. Understanding the cause of foamy or bubbly urine requires a comprehensive diagnostic approach. Medical professionals start with a thorough clinical assessment, including a detailed medical history and physical examination. One primary diagnostic tool is a urinalysis, which tests a urine sample for various parameters, including protein levels. Elevated protein levels, known as proteinuria, can be an early indicator of kidney dysfunction. Medical guidelines recommend using a reagent strip for initial urine testing. A positive result indicates the need for further quantitative analysis. Blood tests are also crucial in diagnosing kidney issues. They measure levels of waste products such as creatinine and urea, which are filtered by the kidneys. Elevated levels of these substances can indicate impaired kidney function. The estimated glomerular filtration rate, eGFR, is another important metric derived from blood tests. Imaging studies provide a visual assessment of the kidneys and urinary tract. Ultrasounds are commonly used to reveal kidney size, shape, and any obstructions. For more detailed information, CT scans or MRIs may be warranted. These provide comprehensive details on renal structure and function. If initial evaluations suggest significant kidney involvement or results are inconclusive, referral to a nephrologist is essential. Nephrologists specialize in diagnosing and managing kidney diseases. A nephrologist can perform advanced assessments, such as kidney biopsies. During a biopsy, a small tissue sample is extracted from the kidney and examined under a microscope. These diagnostic practices follow established medical guidelines to ensure accurate assessment of kidney health. Detailed examinations help pinpoint the cause of foamy urine and guide appropriate treatment strategies. Preventive measures and treatments for foamy urine. Addressing the root causes of foamy urine is crucial for maintaining kidney health. A comprehensive plan involves lifestyle changes, dietary adjustments, medication, and regular monitoring. For dehydration, increasing fluid intake is essential. Drinking 2-3 liters of water daily helps flush out toxins and supports kidney function. If proteinuria is the cause, limit protein intake and follow a balanced diet with fruits, vegetables, and whole grains. Regular monitoring of kidney function is vital. In diabetes management, controlling blood sugar levels is crucial. Diet, exercise, and medications help stabilize glucose levels and reduce kidney damage risk. Periodic HbA1c testing provides a measure of long-term glucose control. This should be part of routine care for diabetes patients. For hypertension, Follow a low-sodium diet and monitor blood pressure regularly. Antihypertensive medications help prevent kidney complications. The DASH diet is recommended to support healthy blood pressure levels. It is supported by scientific studies for managing hypertension. Early intervention is key to effective kidney health management. Regular checkups facilitate early detection and timely treatment. Annual kidney function screenings are important for individuals with risk factors, including family history of kidney disease. Maintaining a healthy lifestyle is essential. Quit smoking, moderate alcohol consumption, and manage stress to preserve kidney health. Adopting these practices helps reduce the likelihood of developing foamy urine and supports overall health and well-being. Understanding the causes of foamy or bubbly urine is crucial for maintaining kidney health. We've discussed key reasons such as high protein intake, dehydration, urinary tract infections, kidney disease, and other conditions. Each requires a specific management approach. Maintaining kidney health is essential to prevent conditions like proteinuria, which indicates filtering issues. Paying attention to foamy urine can help address problems early. Timely medical advice, regular checkups, a balanced diet, hydration, and a healthy lifestyle are vital for kidney function. Staying informed empowers you to make proactive health decisions. For more health tips, don't forget to subscribe to our channel. Share your experiences or questions in the comments below. We'd love to hear from you.